joined. So I am just gonna go ahead and get started. So today we are going to talk about some different sexual dysfunctions in both males and females. I think sexual dysfunctions are often kind of overlooked and forgotten about, and so I'm hopeful that this kind of refresher will help you to be open-minded and talk more about it with your clients, even if that's not their primary reason for coming to therapy. So a little bit about me. My name is Morgan Twidwell, and I graduated with my master's in social work in 2017 from the University of Kansas. Right after that, I worked at Research Psychiatric Center, and I was the therapist for the adolescent PHP program. I did that for a couple of years, and then now I have been working at Resolve for 2.5 years now. I primarily have been working with teens and young adults, and here in the last year or so, I've been expanding more to young adults, just like a little bit older adults. And just starting this year, I started working towards my certification to become an ASEX certified sex therapist. So I'm currently in the process of doing that, still working on my education and collecting my clinical hours and supervision. So here at Resolve, we have our mission, vision, and values. Our mission being reimagining mental health to reduce barriers and improve care. Our vision to create a community in which mental health services are accessible, exceptional, and stigma-free. And our values are high quality, serve the community, prioritize inclusion, compassionate teamwork, and continual improvement. I think with this presentation, I feel like we're working towards reducing barriers, being stigma-free, having inclusion, and continually improving ourselves. Fortunately, through Resolve, I've been able to work on this certification in order for my services to be a little more high quality and exceptional, and really help people in an area where there's not a lot of therapists who are focusing specifically on people's sexual health and some of the issues that they are experiencing there. Just some things for the presentation. If you could stay muted during the whole thing, and holding questions until the end. Whenever we get to the tools and some of the things that we can work on to help our clients, I'll ask if people have questions between each one, just so that we can get those answered, but I'll specifically ask if anybody has questions. All right, so our objectives. After you leave here, I want you to be able to list some common male and female sexual dysfunctions, be able to explain the prevalence and the common etiologies of each sexual dysfunction, as well as having some psychological treatments and tools for those sexual dysfunctions. Okay, pre-test. So I really want you to focus on these questions and try to be mindful of them throughout the presentation. First one is, how long must you experience erectile dysfunction in order to be diagnosed? What percentage of women will never experience an orgasm? And what is the fifth gear of touch? So throughout this presentation, I will address these questions. The first two come up pretty quick, so just be looking out for those. Okay, so I am going to talk about 4 different diagnoses. So for each of these, you must have experienced them for 6 months in order to reach a diagnosis. So for all of them, it's at least 6 months. It also has to cause significant distress, and it cannot be better explained by a non-sexual mental disorder like anxiety, depression, PTSD, etc. It cannot be better explained by severe relationship distress, and just external stressors outside of your relationship. Cannot be related to any kind of medical conditions, and not related to substance use or even prescribed medications that you may be taking. So the first diagnosis is female orgasmic disorder. And so in order to reach this diagnosis, you have to experience one of the following symptoms for 75 to 100% of occasions of sexual activity. So the first one is having a marked delay and a marked infrequency of or absence of orgasms. And the second one being a markedly reduced intensity of orgasmic sensations. And so that has to happen 75 to 100% of occasions of sexual activity. That does not strictly mean intercourse. That can be masturbation, it can be oral stimulation, but it has to occur frequently. Some of the specifiers is either lifelong or acquired. So lifelong meaning from the moment I started having sex until present day, I have had a decrease in orgasms, or not a decrease, I have maintained 75 to 100% of the time not having orgasms or having very low sensation while orgasming. And then acquired meaning it was not always like this, but at some point in my life things changed. Generalized or situational, meaning generalized is that in all sexual encounters across the board, if it's with a man, a woman, masturbation, intercourse, oral stimulation, manual stimulation, toys, whatever the situation is, this is happening. And then situational is that, you know, whenever I masturbate, I'm not having this problem. But then whenever I go and am intimate with my partner, I am having this problem. And then never achieved an orgasm under any circumstances. So throughout my lifetime, and again, in all scenarios, I have not achieved an orgasm. And then mild, moderate, and severe is depending on the level of distress that the client is experiencing because of these issues. So this diagnosis varies widely depending on factors including age, culture, duration, and severity. Age, things can change. So younger women are actually more likely to not have orgasms, especially like in their in their 20s, just because they're still gaining experience, learning their bodies, and you know, as women age and they have more experience with sex, they've gained some confidence and ability to vocalize their wants and needs. They've understood their body a little bit more. You tend to see orgasms increase with age. And approximately 10% of women will never experience an orgasm throughout their lifetime. 10%. But women's most reliable orgasms occur during masturbation. And I think for a variety of reasons, one being you're not relying on someone else to know how something feels. You don't have to ask someone to change what they're doing. You have the control. Generally speaking, whenever people masturbate, they're choosing to do it at a time that feels comfortable for them, versus sometimes with sex, you know, there's someone else involved. And so you may be engaging in sex with someone at a time where you're not the most comfortable, but they are. And so, you know, for a variety of reasons, whether it's hot or cold, or you're afraid kids will run into the door or run into your room. So those are things to pay attention to whenever diagnosing as well. So the next one is female sexual interest and arousal disorder. So for this one, you have to have a significantly reduced sexual interest or arousal in 3 of the following bullet points. So it's an absent or reduced interest in sexual activity, an absent or reduced sexual or erotic thoughts or fantasies, no or reduced initiation of sexual activity, and you're typically unreceptive to your partner's advances. Absent or reduced sexual excitement, pleasure during sexual activity. And again, that needs to happen 75 to 100% of the time. An absent or reduced sexual interest, arousal, and response to sexual or erotic cues. So that can be reading an erotic novel, that can be, sexy talk from your partner, that can be pornography. And then absent or reduced genital or no genital sensations during sexual activity. And again, that is 75 to 100% of the time. So again, some specifiers are lifelong or required, like we talked about before. Generalized or situational. Again, generalized being across the board in all scenarios, situational being depending on the sexual encounter. And then mild, moderate, and severe, again, based off of the level of distress that the client is feeling. So prevalence is unknown due to factors including age, culture, duration, symptoms, and presence of distress. Older women are less likely to express distress, even though their desire may be decreasing with age. And so it's like their desire is decreasing, but they don't really care. And so because of that, it doesn't technically qualify as being a diagnosis because the distress factor is not there. Women in longer term relationships are more likely to report less interest in sex than women in shorter term relationships. We often refer to, the honeymoon stage as like the limerence stage of a relationship. It generally lasts anywhere from 6 months to 2 years. Fewer people make it to 2 years. But during that time is generally when you're, very excited about your relationship, very erotically charged, and you're having sex more often. A lot of people like to say that, oh yeah, I'm sure that stage is related to, having kids and getting married. And really it doesn't have anything to do with that. If you think about it, 6 months, a lot of people are not married with children 6 months into a relationship. And so it really just has to do more with, getting into that comfort with one another, the excitement of it kind of wearing off, those kind of things, and just like regular life, interrupting your relationship. External factors like partner-related stress, interpersonal stress, or personal events may impact desire. This kind of ties back to what we said at the beginning about, all of these diagnoses. You cannot be having, if there's abuse going on in a relationship, that's probably going to decrease someone's interest level and desire to have sex with someone. Also if there's little to no sexual stimuli, then that's also something to pay attention to. I may not be that interested in sex because I don't really have a thing that is stimulating me to think about it. So that's something to think about. And then vaginal dryness in older women is related to age and menopause. And so those kind of things, just because there is some vaginal dryness does not necessarily mean that, my body isn't responding the way it's supposed to whenever you feel desire. And so then therefore I must be, struggling with this sexual interest. Our body's way of responding doesn't always match with what's happening in our brain. A lot of the times society kind of says that, when a woman is, lubricated naturally, that is the tell sign that she is turned on and ready to engage in sexual activity, when sometimes mentally it's like, no, that is not how I feel actually at all, but my body's just responding that way, or vice versa. The next one is erectile disorder. So for that, you have to be experiencing one of the 3 following symptoms, again, 75 to 100% of the time of sexual encounters. So a marked difficulty in obtaining an erection during sexual activity, marked difficulty in maintaining an erection until the completion of sexual activity, and a marked decrease in erectile rigidity. Again, specifiers for this are lifelong or acquired, generalized or situational, and then mild, moderate, and severe, depending on the level of distress that the client is experiencing. Approximately 13 to 21% of men ages 40 to 80 complain of occasional problems with erections. Approximately 40 to 50% of men older than 60 to 70 report significant problems with erections. Acquired erectile disorder has a very strong relationship to aging, and biological factors and medical issues like diabetes and cardiovascular disease. You know, whenever people are struggling, when men are struggling with erectile dysfunction, a lot of the times the first things they'll be told is, you know, quit smoking, lose some weight, exercise, and, you know, stop drinking. And so, you know, their physical health is very strongly related to this issue. And then it's very common for men to have erectile issues with their first sexual encounter due to performance anxiety. And so, you know, if you have someone coming in and saying, you know, I'm concerned because I had sex for the first time and like I wasn't able to keep my erection, you know, a lot of that is very common and normal due to the anxiety that is related to performing well. And so those things kind of naturally fizzle out. They tend to naturally fizzle out on their own. And so really being able to normalize that for people who express that issue. Male hypoactive sexual desire disorder. So this is having a persistent or recurrently deficient or absent sexual erotic thoughts or fantasies and desires for sexual activity. This one is, the judgment of deficiency is really made by the clinician, taking into account factors that affect sexual functioning, such as age and general or socio-cultural context of the individual's life. There is actually quite a bit of evidence that people of Eastern Asian cultures, they tend to have lower levels of desire, both male and female. I think a lot of that is related to their culture and, you know, some of the rules or viewpoints around sex. And so it's not as prioritized as more like European, Canadian countries. So that is something to take into consideration as well, both with this diagnosis and also for the female sexual interest and arousal disorders. And really any of them, because some of it influences a lot of people's perspective on it or how much they care about having orgasms or not. Again, specifiers are the same: lifelong or acquired, generalized or situational, and mild, moderate, and severe, depending on the level of distress. So about 6% of men 18 to 24 have some problems with sexual desire. About 41% of men 66 to 74 have problems with sexual desire. However, like 1.6% of men 16 to 44 have a persistent lack of interest that's lasting 6 months or more, which would, as we said, you have to be experiencing this for 6 months in order to reach diagnosis. And so it's very uncommon. There is a very strong relationship to age and sexual desire. In fact, men are actually more likely to initiate stopping sexual intercourse than women. A lot of the time people think it's the other way around. But once men are no longer able to rely on their consistent erections and those spontaneous erections. It's more common that a man is no longer going to initiate sexual encounters because of that performance anxiety and their and being unsure of themselves. And historically, women have just not really had the permission to initiate sexual interactions. And so, you know, when you think of like the traditional sexual experience, the man is more of like, it's for his pleasure than it is for the woman's, and the woman is supposed to do what he wants when he wants, kind of a deal. And so once the man stops initiating, then sex typically fizzles out. Do we have any questions about any of these diagnoses so far? Okay, I think some other things to consider with these diagnoses is any kind of like medical conditions, because they certainly can impact people's sexual functioning. Medications can decrease people's sexual interest and arousal. We know, generally speaking anyways, that antidepressants can do that for people. Things like any kind of spinal injuries can affect both men and women and their ability to achieve an erection or an orgasm. And so, you know, there are times whenever it's fair to tell a client like, hey, why don't you go to the doctor and get a checkup, so that we can kind of like rule out if there are any other issues going on, while also still trying to figure out like if this diagnosis really fits for them or not. Yeah. Okay, no questions? Okay, I'm going to move on then. So I am about to enter into the different like tools and things that you can do to help your clients. And at the end of each of them, I'm going to ask people if they have any questions, just for clarification, because I feel like a lot of the times we really want the tools, and if I don't understand how they work, then I'm too nervous to actually implement them in my sessions. And so if you've got a question, I will ask at the end of each one. Okay, so the first just kind of general rule of thumb is making sure that you're open and inclusive. I think that we all know that as therapists and clinicians, but unfortunately, sex is one of those things that tends to be forgotten about. And so doing things like including questions related to sexual desire, pleasure, eroticism, satisfaction in your intake paperwork can be valuable. I think a lot of the times, you know, we ask people if they're sexually active, but we might leave it at that. And so having a little bit more in-depth questioning about like, have you ever experienced any issues with it? Also including questions related to their sexuality and gender. You know, figuring out your gender and your sexuality is still a component of sex therapy. And so you want to make sure that you know someone's background and what they're going through also. Vocalize that you take a pro-sexual stance, you know, saying that it's okay to have sex. You know, it's better to understand sex and talk about the issues that you're experiencing than pretending as if it doesn't exist and shaming people for it. And then normalizing their experiences, you know, looking back at the information that we just went over, you know, for example, like 10% of women are never going to have an orgasm. And so if you're talking with a woman who has expressed some challenges with that, being able to normalize that, you know, you're not the only one. This happens more often than you think. And just because you haven't so far doesn't mean that you never will. Okay, so the first one is the 5 gears of touch. So understanding the 5 gears of touch is very helpful for couples because unfortunately what happens is a lot of couples focus on 2 of the 5 gears, and they focus on affection and intercourse, and they miss everything in between. And everything in between is really what helps to build up that desire and arousal that makes number 5, intercourse, more enjoyable. A lot of people think that sex is simply just intercourse, and that's just not true. There are so many other things aside from that. So the first one is affection. And so that's typically like clothes on, not sexual in nature. And then your subject arousal level, meaning like on a scale of 1 to 10, how aroused am I feeling right now, is at about a 1 or a 10. You know, these are things like holding hands, hugging, things you would maybe be comfortable doing in public. And there is no genital touch during affection. Number 2 is sensual touch. So this is non-genital pleasure. During this time you are clothed or semi-clothed, and your subject arousal level is between a 1 and a 3 out of 10. This can be things like a back rub or a foot rub, or cuddling on the couch while watching TV. Things where you feel like just kind of like snuggled up and safe and comfortable with your partner, and something that you might typically do more in the privacy of your own home. Playful touch, this intermixes genital and non-genital touch. You're typically semi-clothed or nude during this time, and then your subject arousal level is at about a 4 and a 5 out of 10. So this can be things like taking a shower together and like washing each other in the shower. It could be like playing strip poker or Twister or something like that. But it's something that's more playful in nature, and it allows for that emotional connection, while also kind of incorporating some of that sexual touch with one another. Erotic touch, and so this is non-intercourse touch. This can proceed to an orgasm or transition into intercourse. Your subject arousal level is at a 6 out of 10 of 10. So this can be manual stimulation, oral stimulation. This can be toys, anything basically outside of intercourse itself. And you know, during this time, both the man and woman can achieve an orgasm during that time. And it's kind of that stepping stone into intercourse if you prefer to do that. And then the 5th one is intercourse, and this is a natural continuation of pleasure and eroticism. It is not a pass-fail performance test, and your subject arousal level should be at about a 7 out of 10. A lot of the time, there's a lot of performance anxiety, especially for men, but I think also for women, when it comes to performing in bed and having things go just perfectly fine, which it doesn't always happen. I think that that's why, you know, you really want it to be that natural continuation and not feeling like I have to do this in order for this to be like a successful sexual experience. But yeah, that 5th one, intercourse, keep that in mind for your test. And so knowing these and understanding these is valuable. And then what I would progress to, like this part is the education component with your client. And then this could be an exercise that you could do for a couple, and where they both rate like out of 100%, where do we feel like the percentages fall in each category right now, and then where would I like it to be. And this is really a tool that helps couples just to like start the conversation. It's not necessarily a specific action step to take to implement these things, but at least is a discussion tool and helps to develop like a stronger level of understanding for what their touch looks like and what they want it to look like. So do we have any questions about this?
Hey, Morgan.
Yes.
My question for you, you said this is a great tool for like couples. Would you consider this in the intake or process, or kind of like after treatment, planning? What are your thoughts?
Yeah. You know, I think that in the intake assessment, since, you know, we're all trying to cover so much information in the intake assessment, and I feel like this is something that you could implement a little bit later. I feel like it's a great like first tool whenever you are you know, kind of figuring out like where is your guys' touch, how do you guys feel about your sexual interactions. I think that this is information that you can gather and educate them on maybe like a couple of sessions in, especially if their primary concern is their sexual activity. Does that answer the question okay?
It does, thank you. So just kind of later in the process a little bit, but because you're covering so much in intake.
Yeah, you know, because in the intake process, I think it's really valuable. I mean, I think it's hard whenever you're whenever you're not certain that someone is coming in for a sex-related issue. I feel like a lot of the time that's not the first thing that people disclose. But it still is so common with our clients. And so like getting some like background history on their experiences with sex, you know, if they're in a relationship, then, you know, their couple's sex and what that looks like. And, you know, if they're satisfied or not, and if they feel like, you know, it's fine, but I feel like there's room for improvement, then I also feel like this is a really great first tool to use because it really lays it all out there. And I think it gives people like a concrete stepping stone to take and like an area to focus on. And like they can define what each type of touch, like what that looks like for them and what that means to them and what they enjoy and don't enjoy. And I feel like it helps break down the kind of steps in your sexual experience with one another.
Thank you.
Okay, this next one isn't so much a tool as it is just kind of like an idea concept. So it's this idea of responsive versus spontaneous sexual desire. So the information that I have on this is really geared towards heterosexual couples. However, I think that the concept still applies to non-heterosexual couples. It's just kind of the verbiage here is really geared towards more of that. So responsive versus spontaneous sexual desire. Responsive sexual desire is like, okay, I currently am at a level like 0 out of 10 with my subject arousal level, and I am not currently interested in having sex. However, if we started to engage in some of those 5 gears of touch, I might get to a point where I am turned on and do want to have sex. Versus spontaneous sexual desire is, you know, randomly at 2 o'clock in the afternoon, I'm ready to go. And Stereotypically, people associate spontaneous sexual desire with men and responsive with women. However, it happens on both sides. But that responsive sexual desire is like, I have the ability to say no. I also have the ability to choose like alternative outcomes for this sexual interaction. It does not have to lead to intercourse. Or it can be like, it could be like the traditional intercourse of where that experience is like a level 10 for a man, but it's more of a 4 of a 6 for a woman. The woman could pleasure him to an orgasm, or she could hold him while he stimulates himself to orgasm. It kind of allows for that freedom and that flexibility and not feeling pressured to have to engage in intercourse. Male's spontaneous desire is kind of related to those natural and predictable erections and orgasms. A man could have an erection at some point in the afternoon and, not really even have that like erotic stimuli that really led to the erection in the first place. And so that would be kind of more of that spontaneous sexual desire. But something that's really important for both men and women to understand is that women's sexual desire is not second class. And it's not, they're not any less than for being more responsive than spontaneous. I think that men, generally speaking, view sex through their own eyes and think that a woman should have the same spontaneous desire and and that their orgasms should be as consistent as theirs are. That's kind of that traditional view, but that's just not the case. And whenever a man understands that this responsive desire, and if I utilize these 5 years of touch and really try to please my significant other, then that like desire and eroticism and arousal and all of that will follow through, and those sexual encounters can be far more enjoyable for both parties. Do you have any questions about that? Okay. Okay, so then these are some desire psychosexual skill exercises that you can give to your couples. I really like these a lot because it's very like, take this home and go do it and see how it works kind of a situation, which I enjoy. So the first psychosexual skill is developing comfort with your significant other. And so this is really like a 2-part skill. And so the first one is in the comfort of your bedroom. And you do not have to be like, you can be fully clothed during this situation. And what we do is call it like non-demand touch for your own pleasure. So basically it's taking turns touching your significant other without the expectation that sex will follow. And so you can use your hands and your face and your feet and your stomach and your mouth. You can use whatever you want, but you are touching your partner for your pleasure, not really for theirs. And it is creating this scenario where you're really developing that comfort level with touching one another. The woman should be the person who goes first as far as the touching goes, in order to increase that comfort for women with initiating. I guess it doesn't necessarily have to be the woman, it's just whoever maybe is not the initiator, typically have them go first. So that's the first one. And then you take turns doing that. And then the second part for developing that comfort is being like partially or fully nude, like in your living room. Okay, so obviously you have to arrange for childcare if that is the case, or be very, very confident that they're not going to come downstairs. And during that, you talk about your sexual experiences with each other while nude. And so when doing this, you really want to make sure that you make the environment that you're sitting in as comfortable as possible. If you want to have music playing, if you want to dim the lights, if you want to have a glass of wine while you do it, if you know, you want to like be facing each other, if you want to sit just like side by side, and maybe it's like we look at each other, but it's not just direct eye contact, whatever makes you feel the most comfortable. It can be helpful for you to like hold hands while having this conversation, or like maybe have like, you know, caress each other's back, something like that. Just helps to develop that that comfort with one another during the conversation. And then, you know, it's about really talking about your fondest sexual memory with one another, and really going into detail about what you liked about that, and what that experience was like for you, everything from beginning to end, of like, this is what we did leading up to it, this is what we did during, this is what we did after. And that can be really increasing that level of comfort, which is communicating with your partner about sex. The second one is couple sexual attraction. And so this is sharing 5 to 15 things that you find attractive about your partner. And that can be anything from, you know, how they, you know, do chores around the house without being asked, to a way that they touch you, to them having like a great work ethic, or how they, you know, have a great relationship with your mom. Like, it could be really anything. And then you discuss 1 to 3 things that you would suggest that they change to help build that attraction. It's not a demand, it's a suggestion. It allows them that freedom to say no, or to come to a compromise. It also cannot be things that they cannot change. So, you know, if your partner is, you know, 5'9" and you're like, oh, it'd really be great if you were 6'4", that's not helpful, because obviously they can't do anything about that. But you need to have like very specific examples. Like one of them is, you know, when you initiate, kiss me and stroke my arms before you touch my breasts. And so that way it really gives some significant and clear suggestions about how to help. And then again, start with the person who maybe struggles the most with initiating things, and then go from there and switch roles. The third one is trust and intimacy. So this is developing a trust position. And so this could be spooning, this could be someone like sitting while the other person has like their head laid down on their lap, it could be laying with your head on their chest. During this time is something where you feel comfortable doing in the nude. And this is a really, really valuable tool to utilize after you have had a negative sexual experience. Talking about that negative sexual experience while naked, sitting there next to each other, not helpful. Instead, we want to utilize this trust position to kind of like reestablish that connection after a negative experience. Knowing and understanding that, you know, like, sex is not going to be 100% perfect every time, and that is okay, but we still love each other. We still are intimate and attracted to one another and everything. It was just, we just had a bad experience, and then we'll try again in the next like 24 to 48 hours. And then the final one is creating your sexual scenario. And so this is where you take turns discussing what like your like ideal sexual scenario would be. So what time of day would that be? Where would it be at? What kind of things would help set the mood? Would it be if you guys had music playing? Would it be if it was after you've had like a good conversation with each other? Is it, you know, having, you know, socks on or no socks on? Is it, you know, just all of the specifics, the script leading up to it, like what are the things that you guys do as far as communication leading up to it? Is it like we need to have these certain tasks completed before I feel like I'm not concerned about the fact that there's dishes in the sink beforehand? And then how do we transition from pleasure and eroticism to intercourse? So, you know, are we kissing first? Is there oral stimulation involved? Are we like naked the whole time? Or do we transition and do we undress one another? And then what positions that we like with intercourse. Do I prefer to be on top whenever you start, or on bottom, or you know, whatever that looks like. And then the ending. And the ending is really important. People tend to forget about that. You know, don't just finish and pop out of bed and leave and not talk after that. You know, do you want to lay there and joke and laugh and cuddle? Do you want to go and take a shower together? Do you want to continue to just kind of like rub on each other while you lay there? All of those things are really important whenever you are developing this sexual scenario. And so you allow for one person to share theirs, and then the second person goes and shares as well. And one thing to really be mindful of is that it's not a competition, and nobody's sexual scenario has to be better than the others. It's just about being genuine and expressing what really puts you in the mood and makes you feel confident and sexy and seen and safe. Do you have any questions about any of those? I know that was a lot. Okay. All right. Any questions about this entire presentation? Okay. Well, if you have any questions, you can email me at morgan@kcresolve.com, or you can contact the office and they can let me know, or you can go to the website as well. So yeah, that's really all I've got for you guys. I appreciate you watching, and I hope that you guys have a good rest of your day.